stay on this.
Okay, so we're going to go ahead and get started. Hello, and thank you for your participation in today's workshop, Understanding and Preventing Falls from the Perspective of First Responders. Before we get started, I'd like to review some general rules for the workshop. Please stay muted for the duration of the workshop. You will know that you are muted if you see a red slash through your microphone icon at the bottom of the screen. All workshops will be recorded and uploaded to our website at a later date for others to view. If you do not wish to have your video appear in the recording, please disable your video. To ensure that you have a good view of the speakers at all times, please select Speaker View. You can adjust this setting in the top right-hand corner of your screen. Please type any questions that you may have in the chat box. There will be a time at the end of the workshop for our speakers to answer questions. Please join me in welcoming Karen Leventhal, who will be moderating this workshop and introducing our speakers.
Oh, Karen, you're muted.
Better?
Yep.
Okay, so sorry. Hi, everybody. I'm Karen Leventhal, and I'm with Seniors Choice, and I've been a fall prevention task force member for over 12 years. And I'm excited to introduce to you three amazing firefighters and paramedics. First, I'd like to introduce to you Ennis. Ennis Jackson is a driven professional advanced life support caregiver with over 35 years of business success, including providing emergency care, training, motivating, and educating on a national level. A fun fact about Ennis, besides him having a great sense of humor, is that he is a member of the Screen Actors Guild and AFTRA, and he's been in movies including Traffic, The Take, and Home Invasion. Next, I'd like to introduce Brian Viara. Brian has been a member of the National City Fire Department for 17 years and is currently at rank of engineer and paramedic. Additionally, he has had 22 years of experience in a pre-hospital setting. Brian is a native to San Diego, has a wife and a 7-year-old daughter. In addition to his fire department duties, him and his colleagues formed a partnership with National City Fire Department and Point Loma Nazarene Nursing Program. And together they work on public health issues such as flu vaccines and fall prevention. And sitting alongside Brian is Captain and Paramedic Scott Robinson, also a native San Diegan who's been in the fire department for 18 years and has 2 kids. In addition, our final presenter, or our question and answer guy, is retired Deputy Chief from the City of Encinitas, Jon Blumeyer. He is currently working again as a fire captain and paramedic for the Valley Center Fire Department. He has over 36 years of fire and pre-hospital EMS experience. He has a BS degree in emergency medical care from Loma Linda University and taught paramedics and EMTs at Palomar College for over 10 years. So thank you guys for taking time out of your busy schedules to spend time with us in this next hour. I know we're going to learn a ton of information from you, and I can't wait to hear what you have to share with us. So thank you. So Ennis, I give the floor to you.
Well, thank you very much. Welcome, everybody, to this evening of social media. Again, my name is Ennis. I've been in EMS for quite a while. We're going to be talking about falls. And when my PowerPoint comes up, you see exactly what I'm talking about. Understand that falls is gravity, and gravity wins most of the time when we're not in control. So am I switching to PowerPoint, or are you switching it? Who's switching pages?
Hey, we're having some technical difficulties. I'm gonna go ahead and pull it up on my end. I think
Okay.
That'll work. So give me 1 sec.
Okay.
Alrighty. able to see? Everything looks good?
I can see it. Can everybody else see it?
Perfect.
Great. We can go to the next page. All right, as you can see, what we're going to be talking about, and it won't be very long, is the elderly. What makes an elderly? Then the falls. That's one of the number one emergency calls that paramedics and EMTs and firefighters go on, are elderly falls. Then 911 dispatcher. What does the 911 information? What is that information that you give the 911 provider? It's stuff that we need to know. And then who will you get? As you heard before, life is like a box of chocolates. It depends on what your call is. If you've fallen down and you hurt pretty bad, you may need just a fire engine and a paramedic ambulance. We're going to talk about that. Or you may need further resources. Now, what is wrong? You need to tell a dispatcher, where do you hurt? And where are you? What part of the house or apartment or condo are you at? Are you upstairs? Are you downstairs? You're in a patio? We'll talk about that too. And of course, the Vial of Life. Everybody is usually familiar with that. And it's usually stuck on the refrigerator. And we need to know one most important thing about people who falls. And usually it's the elderly that are on blood thinners. That requires further treatment, a specific location to be taken to as well. We can go to the next page. All right. I have run across quite a few people in my tenure as a paramedic, and most of them are very happy, but some of them are pretty grumpy. Some of these guys are angry because they're broken bones, they fell down, and usually the elderly is referred to as a person who is over the age of 65. So however, some people may think differently. Look at that young man right there with his fist balled up. In case in point, you refer to this man as an old man, he might not like that. He will refer to you as, I am not an old man. I'm a young man. Even though I'm 70 years old, I'm still young. And we have to respect that. And that's okay with me. It should be okay with everybody else. Okay, next page. All right, now, as you can see, when you fall down, you are on an uneven pavement. Look at the steps. It's not always like that because you can just fall in the kitchen, you can fall on the grass, and you can fall just taking a walk with your family. But if you fall on steps like that, you are hurt in many ways. Your hips, your back, your neck, and look at your arm. You use your arm to prevent you from falling, from getting hurt. That could dislocate your shoulder or your elbow. So we need to know all this stuff. And that dispatch needs to know that. So tell the dispatcher, where are you, what hurts, and if you feel like if anything's broke, know that. If there's somebody with you, they need to know if you lost consciousness or something like that. But the idea is not to fall. So you take your time going up those stairs. Take your time coming down those stairs. If you can't make the stairs, then get some help or go around a different way. Next slide. Okay, who will you get? You get typically a paramedic ambulance and a fire engine. There are times that we get people that are sometimes over 500, 600, or 700 pounds, and one engine, one ambulance may not be enough. They may be elderly as well. So we're going to get a fire engine, we may get a police car, we may get a truck, and of course we maybe get a battalion chief or anything else if it requires any extra effort to get you out of the house or the location that you're in. So don't be surprised if you see more than a fire engine or an ambulance show up, because it may be a cop, maybe a battalion chief, maybe a big truck company. Don't be surprised, because that's all for you. And we want the best way to get you out of there, and the safest way to do that is when we have extra help. Okay? Now, a little bit of anatomy. What's wrong with you? I usually sing that song, the neck bones connected to the jaw bone. All that stuff is connected. So when you fall and you hurt your head, you may hurt your neck. So look at that when I have pointed to the head, you got skin tears and you got bleeding. So this is when that blood thinner part come in. And look at your hip, we're talking about hip fractures, and your back, we're talking about bleeding. broken back, broken bones, spinal cord injuries, and you can get a spinal cord injury from falling from a standing position. So you must be careful. You must take your time when you get up and walk. Don't be in a hurry because you can injure yourself to the point where you can be paralyzed. We want to prevent that. Understand that gravity is extremely powerful, and it's not just the elderly that's affected, it's everybody who's affected by gravity. Look at your fingers, toes, foot, all of those have bones that breaks, okay? All right, where are you in this beautiful multi-million-dollar home here? Look at this big house. You call the paramedics, you call the fire department. We need to know exactly where you are. You may leave the door unlocked or maybe not, but when we come in there, where are you? Are you upstairs on the second floor? Are you on the third floor? Are you in the bathroom? Let us know where you are, especially if you're by yourself. If somebody's there, of course, they can lead the way, lead us in there. But there's one thing that I want to remind you of is I need to know if you have other things in the house. You call 911. Okay. Do you have dogs? Do the dogs bite? That's important because we don't want to be chewed up by your pet. And if you happen to have exotic pets, please, please let the dispatcher know. Because I went on an emergency call where we can see this elderly lady sitting on the kitchen floor through an open window next to her front door, and she's sitting there and looking like she's in pain. There was no way to get in, so we had to break the door down. It'd be nice if you have a hide key outside or some other lock that we can open to get in, because we prefer not to break doors. We prefer not to break windows. But when we went inside this home, oh man, I'm sitting down there talking to this young lady, and from the corner of my eye, from around the corner, came slithering a 6-foot boa constrictor. Now, I need to give you a little history on me. If I see a snake, I get diarrhea. So I'm sure National City can tell you that, T-Dub and Scott there. I was sweating pretty much. And I said, oh my gosh, look at that, a snake. And the lady who was injured said, oh, that's Charlie. I went, that's Charlie? Oh yeah, he's family. I said, you need to let the dispatcher know that Charlie lives with you and what Charlie is. Because I certainly would have let the firemen go in first and handle that situation. In fact, I might not have just gone in, they might have just brought him out to me in the ambulance. That would have been better for me. Okay, next page. The Vial of Life, how important is that? Well, first of all, what is it? It's information that tells us about you, your medical history, your age, your family, your next of kin, what kind of medical problems you have, what medication you are, your doctor's name, other phone numbers that we can reach. It's best that you have it attached to the refrigerator on a magnet. And why have it? Exactly. It's because we need to know more about you. If you are unconscious, how are we going to know anything about you? There is a Vial of Life right there. What information is needed? Exactly what I mentioned. We need to know everything that we can possibly know about you, especially your next of kin, so we can call and ask them about you. Next of kin contact numbers are very important as well. In the next page. All right, let me explain to you what blood thinners are. Blood thinners are medication that thins your blood in case you have an irregular heartbeat, you have blood clots. We want to thin your blood so you don't have a stroke or have an occlusion in your pulmonary artery or some other thing in your heart. So that's why your doctor puts you on blood thinners. The problem with blood thinners is if you fall and hit your head, it's going to cause you to bleed internally inside your head. Well, paramedics, firefighters, and EMTs cannot fix internal bleeding. We need to take you to a trauma center. So it's extremely important that we know if you are on blood thinners. And even fish oil is also considered to be blood thinners. So if I see you have a bruise that bruises easy, I might consider you to be on blood thinners even if you can't talk. So on that vial of life, it'd be nice to know if the blood thinners are on there, because that determines which hospital you're going to. We're not going to go to a basic one. We're going to go to a trauma center. Okay, next page. All right, this was a video, and it was pretty cool, but due to current technology, we were unable to play it. And you would have got a pretty good cackle out of it because it shows a lot of people falling, dogs making them fall, children, little children making them fall, people riding bikes, even elderly people riding bikes, falling off of that. And there are elderly people who goes specifically to an area where they want to have some fun, like an amusement park. Well, there are certain rides you shouldn't get on. When they get off of it, they're dizzy. They walk around and they fall and they hit their head and they're injured. So my apologies, folks, for we can't be able to show this video, but it was really cool. Next page. All right, looks like I'm done here. I'm gonna give you back to Miss Kara.
Well, hello, everybody. I'm going to talk about some of the same things that Ennis discussed on because they're really important, and maybe elaborate a little bit more on it. And we're going to go into a couple of things about Karen asked us to gave us a couple other topics to touch on. So one is before we get into the heart of my presentation is Karen asked, how do people contact first responders? And everybody knows of 911, but also a lot of people have heard of the medical alert alarms, or there's other brands out there. I know they're the fallen I can't get up pendants. So those are a good way to contact first responders for help, as well as 911. But then a lot of people don't know about if you're thinking that it's not an emergency, but you want some other information. The county is really promoting this 211 number to direct you to information or other resources. And then also many medical insurance companies like Sharp or UCSD have helplines and nurse lines, hotlines that you can call if you don't think it's an emergency and you're just looking for information. But when in doubt, calling 911 is the best way to get a hold of first responders, and we're glad to come out and give you a hand with whatever. Okay, we'll go into my slide. So we polled all of the firefighters and medics that I could get a hold of, and we came up with the top 3 topics for fall prevention, or things that we like to know when we're responding to a house. And so number 1 is the Vial of Life. We can't stress that enough, the importance of that, and I'll get into it a little bit more. 2, if you don't have a Vial of Life, being organized with medications and medical history, and having caregivers or family members that are well informed and know about you. So it's good to always share with your family what's going on with your medical problems or medical history. And so having family there that knows about you is really important to us. And then 3rd would be access to your house. And I'll go into a little bit more detail on that. So next slide. So the Vial of Life, the symbol over there on the right of the screen is what the sticker that they usually give you if you have one, but there's many other forms. It's basically a condensed information sheet that condenses your contact information, your medical history, your medication lists, and your family contacts. This is really important. And then I listed a phone number there and a couple websites there to jot down if those are good ways to get them. Also, I'm sure any information on the Fall Prevention Task Force people and their website, they would direct you to get one as well. Also, you could probably stop by, I know we do at National City Fire Department, you can stop by any local fire station and they'd be happy to give you one. We have tons of them here, and I'm sure other fire departments would hand them out to you too. Also, the Vial of Life has information about recent surgeries or other things that might be an issue. And also there's even a section on here about pets, and it's touched on that, and good to know that you might have pets that need to be taken care of if you have to go to the hospital or something like that. So one thing would be to update this Vial of Life often. Maybe take it with you every time you go to the hospital or to the doctor's office. That way you can get a new list of medications and maybe update any recent medical changes that you've had.
So one of the things that we always want you to do, we usually will give out when we go on medical calls, we'll decide if they need a Vial of Life or not and hand you one. And what I like to tell everybody is make copies of this Vial of Life, because if you use the one form that's in there, you're not going to have any more forms. So I like to make copies so that you have kind of an original that you can keep, and you can change it every time things change. So anytime you get a different medication, you can change the Vial of Life. Anytime you have an additional surgery, anytime you have an additional medical problem, that you can add to it. So we want to try to keep them updated and at least update them every 6 months if nothing changes. So we kind of tell people, just like your smoke detectors, every time the time changes, update not only your smoke detectors, but update your Vial of Life as well, just so that we have most accurate information. Because if you're not able to talk because you're unconscious and no one else is around that knows your medical history, this form is by far and away the best way we can get information on you so that we can treat you appropriately and take you to the best hospital for your injuries.
So yeah, phone numbers change, doctors and insurance changes. So, updating them would be a great idea. Also, Ennis touched on it, that most of the time these are designed to be kept on your refrigerator. We all know to look for it there. But also if you can communicate with us, or family members or caregivers are there, know exactly where that is if it's not hanging on your fridge. So you can grab it for us, or we can find it real easy and get that information. All right, so next on the slide. So if you don't have a Vial of Life, we ask, and what's really important to us first responders is being organized with any medical information or organized medications. So some people keep their medications in those little Monday, Tuesday, Wednesday, Thursday, Friday packets. Those are nice, and you know exactly which pills to take, and you're not going to get confused, take too many or take too little, but those don't have the labels on them. And so we really need to, what we really need to find are the actual bottles. So always keep the bottles of medication, and better yet, keeping an organized and updated list of medications gives us a ton of information and is very important to us.
Also, if you can, we know most medications and what they're for, but we don't know everyone, especially the new medications. So if you have a medication, write down what it does for you. So if it's a blood thinner, write down, so Eliquis, and put next to that blood thinner. Also, it's very important to know what blood thinners you're on, not because if they need to reverse your blood thinner, make it so you can clot better because you're bleeding, they need to know which one you're on, because each blood thinner has a different reversal agent. So that's very important to know as well.
So I wrote down a lot of the most common blood thinners here. And those should almost be starred on any medical list or medication list that you would have. So exactly, so we know, hey, this is a big red flag, you're on a blood thinner. And it's okay, blood thinners are a good medication to be on. They prevent strokes, they help you with some heart conditions. And so, please don't be afraid to take these. It's just we ask that we need to know, and you're at a little bit more of a risk if you are at a high fall risk setting or situation. Also, please, any pharmacists would be happy to go over, if you have questions, and I'm sure any doctor's office or nurse line would be willing and able to answer questions if you're getting confused or have, need further information about any of the medications you're on. I have down at the bottom advanced directives, and I'll talk a little bit more about that with the next slide. So to go along with this, having, of course, yourself be informed about any medical history that you have, but family members and if you have a caregiver, having them informed about your medical problems or medical history is very important to any first responder. For them to know where to find information or find that Vial of Life or find that medication list is imperative. So a lot of times we go to somebody's house and oh yeah, I've got this great medical history file, and it's a stack of 100 pages. It's going to take us all day to look through that to understand and find out about you. So we asked for a highlight sheet, which is basically the Vial of Life. But if you can pare that down and give us the highlights, that would be very important to us. And then I say here medical decisions, and that's kind of who, maybe some people have different situations at home, and they have their next of kin making medical decisions for us. That would be very important to highlight on any sheets, and we need to have that contact information if they're not living with you. And then also advanced directives. Those are information sheets that give us an idea of medical decisions that you have planned out. Maybe you want certain procedures done or don't want certain procedures done. And those need to be well organized and up at the top of any medical information list that you give us.
And you really need to have that conversation with your family before you go unconscious or before something happens to you, so that they understand what your wishes are. So if you have an advanced directive that says, hey, if I have a heart attack and the fire department comes, I don't want them to do CPR on me. I want to be able to die and pass peacefully. If we come on scene and your family wants something different for you, we have to listen to what they say. So that's really imperative that you have that conversation with them, that they know what you want, and then they can help guide us with what you want with those advanced directives. And please have a copy of your advanced directive, because if we don't have a copy of your advanced directive in our hands, we can't do what you want us to do, and we have to do what we are required to do by law.
I know it's tough to think about or talk about sometimes, but it's a it's a conversation that needs to happen. And it doesn't always have to be for end of life decisions. It could be for some things like I don't want a blood transfusion, or I don't want a certain procedure done. But and then obviously it can go up to the fact that if I stop breathing, I don't want to be revived. So with that, hopefully I've answered questions on that. We'll go to the third most important to first responders is access to the house. So Ennis touched on this a little bit. We need to be able to get to you. And we do not like breaking doors down, but we do have the tools to do it. So we can get in no matter what. However, having answering all the dispatcher questions is really important. And, if you can direct them to hide a key or a combination for the locks box, if you can have that on your front door, that'd be great. Some people, you would have to, if you're calling 911, you would have to be able to speak to them and give the combinations. But if you're in a situation, maybe you're alone and afraid that we're not going to be able to have access to your house, you would be able to contact your own, whatever city you live in, the fire prevention area or fire prevention department. And what's that? Bureau, Fire Prevention Bureau. And you could give them information to a lockbox and they can add it to our dispatch notes. So we would automatically know exactly if we're responding to this address, it would be in a little note for us as we're responding to say, okay, the combination to their house is 1, 2, 3, 4, and we can get in.
Or the key is hidden underneath a certain flower pot or something like that.
But if you do that, it would be important to update it if anything changes. So other things we have access problems with cars blocking driveways or cars blocking stairways or ramps. Some people have different ways to get in their house, and having those free and clear would be great. Also, people have people have sometimes main stairways or houses that are very cluttered, and that's obviously a fall hazard for yourself, but also becomes an access and a problem to get to you for help. So maintaining a house that's free of clutter is important to first responders. Let's see, next. Okay, so did you want to touch on something here?
So one of the questions that we have asked to us quite commonly is who responds to a fall? And Ennis touched on it a little bit. Do you get the fire department? Do you get the ambulance? Do you get just EMTs? Do you get paramedics? And the answer is going to vary depending on what city you live in. However, for the most part, you're going to get a fire engine coming to your house and an ambulance. Fire engine most of the time gets on scene first because we're scattered. There's more fire engines than there are ambulances. And we're strategically located throughout the city in order to effectively respond in a timely manner. So for the most part, you're going to get a fire engine. Most fire engines have paramedics on them. So you're going to have paramedics along with the fire engine. And then we'll be able to stabilize you, treat you if anything happens, or treat any life-threatening injuries. And then we're going to have an ambulance, which is an ALS ambulance, which is advanced life support, which are paramedic ambulance come. And they're the ones that are going to transport you to the hospital. If we feel, the fire department feels that it doesn't necessarily necessitate an ALS ambulance, we can downgrade it to a BLS ambulance, which is EMTs, which is just a little bit lower level of care, but they still are very professional, and then they can still take you to the hospital.
So one thing I wanted to touch on that a lot of people don't talk about is, what do I do after a fall and maybe I'm not injured? So I'll go through a couple of the steps there. So for some reason you end up falling, the one thing we say is to stay calm and don't panic, because that could maybe cause you to have further problems. So evaluate yourself. I have a video that I would have shown that kind of goes through these steps, but rotate arms, legs, your head, and see if you're injured. If you're injured, of course, call for help. And when in doubt, call for help. But if you feel that you're not injured, you want to try and get back up yourself, following these steps can help you maybe not fall again and then hurt yourself. So this is assuming you're on your back. Kind of pick a side to roll to. Roll with your head first, shoulders, arms, and then kind of swing your hips over and get to a crawling position. Crawl to a steady piece of furniture, not a chair with wheels on it. Hopefully a chair, a couch, maybe even stairs, a table possibly, and crawl over that, put both hands on, and have one leg come up to a bent position. Then using your leg strength and your arms together, then lift up, and using the chair kind of to steady you, turn and sit in the chair. Then reevaluate. Of course, call 911 again at any time, or if you have a pendant or maybe you can't get to a phone, yell, bang on a wall for help. A lot of times neighbors and people are always willing to help and get you the help you need. Next slide. So this was the video. So I apologize. We'll go to the next slide. So this would be, say you're having to assist a family member or a friend that has fallen, and maybe just trying to lift them up is going to hurt you both or cause you both to fall back down. So of course, call 911 if they are injured. But if if they feel like they are well enough to get back up on their own, tell them to stay calm. You're going to help them out, and you're going to bring 2 chairs or 2 sturdy pieces of furniture for them. One in front of them and one behind them. They're going to do the same kind of thing, but you can assist them to roll over on one side, and then to their crawling position. Having their 2 hands on that steady piece of furniture and one knee bent up and lifting up, and then they can go ahead and sit back and down in the chair that you put behind them, and then you guys can figure out if you need help further or not. And I think that's about all I have. Did we?
Okay, great. Thank you guys so much. You were so informative. And if we can have Jon come, have Jon's picture highlighted, that would be great, that we could have answer some questions that people have had. And if there's anyone who has any questions, please put it in the chat button below. There's a little button that says chat with like a little bubble. Just click on that and type in your questions and we can ask Jon.
I should be here, I think.
There you are. Oh, good, Jon. I have a question for you. I have a few questions myself, actually. Number one, is there a special fall unit that is like if someone is a consistently falls that you could call, as opposed to having everyone come out, the whole crew come out? Is there a specific unit, just a fall unit?
Most places don't have something like that, and the reason for that is that in most jurisdictions, you never really know where that fall is going to come down. And so the fire department is always going to be pretty much the closest responder to where somebody falls. So they're going to be the ones that are going to take that call and go on the person that falls. Now, if somebody has frequent falls and they've called 911 multiple times, what we try to do is then get them in touch with home health care and maybe some living assistance type programs, so that they have someone that comes and checks on them. They can come out to their house and kind of evaluate them for fall prevention, and to help them either not fall or to be safer if they do fall, or maybe get them a little more help so that if they need help to get up to go to the bathroom or something like that, and that's when they're falling, someone that's there to help them get to the bathroom to keep them from falling during that time. So there are avenues that we can do, but usually they're after we've gone to the call to that same residence for a few falls, we'll get that kind of thing in motion.
Got it. Well, that's great that you're willing to go the extra mile and help, and of course go the extra mile and help people prevent them from falling. So we appreciate that. Hopefully you guys have our fall prevention catalogs that you can hand out. And if not, we'll be sure to get them to you guys. Let me ask you, so when you do get a call, whether it's via like the personal emergency response system, or whether it's someone did call 911, what information are you provided?
Usually it kind of depends on how we get that call. If the call comes in through 911, obviously it's going to be dependent upon the dispatcher that takes that 911 call, the 911 call taker, and they will ask a series of questions. They have a kind of a cheat sheet that they go down. It's a flow sheet that they ask questions from. They ask who's fallen, where are they breathing, the whole litany of questions to kind of determine where that person is and what the level of the fall is, how old the person is, those kind of things, because that'll kind of determine how our response goes from that point. So the 911 dispatcher, if they're in contact with somebody, they can get a lot of that information. the thing to remember that if you're the one calling 911 is that as soon as you dial 911, your location, one of the first things the dispatcher is going to ask is, where are you? You give the address, and as soon as you give that, they send that to the fire station that's closest to you. And we're on our way. All the questions that they're asking while we're on our way. So it's not a delay to answer those questions. We're already coming. They're just asking those questions, and they update us with that information while we're en route to your house.
Wow.
So if it comes through 911, that's the way that the information is kind of sent through. Now, if it comes through one of the personal alert systems like the Life Alert or Life Assist or one of those the push button pendant kind of things, we get responded to what's usually a response from a medical alert alarm or medical alarm. And those we don't get much information on. The medical alarm is usually tied to a specific address. So that's what we get is the alarm will go off. The alarm company attempts to contact the homeowner or responsible party. But as soon as they get the alarm, they're also on the phone with 911 dispatcher, and they give the 911 dispatcher that information. And then we go on the call kind of blind. We don't have a lot of information. And then the alarm company actually continues. They usually have a list of phone numbers they call to try and get a hold of family members or caregivers or something like that to try and get information. So we'll sometimes get to the call and we won't have any information. So where you are in the house when that button was pushed, we're kind of going in blind at that point. And a lot of times we'll go in and someone's had that pendant on at night and it's 2 o'clock in the morning and we're banging on the doors and we're trying to get in and they haven't had a fall at all. And they actually just accidentally pushed it at night when they're sleeping. So we do get a number of false alarms that way, which is fine. We'd rather see somebody not go out and have somebody not hurt than obviously have somebody hurt. But to clarify that when we go in like that, we're going to be pretty hesitant to walk into somebody's house at 2 in the morning in the middle of the night. We've got to be very careful because there are dogs and, as Ennis said, snakes and other critters, and sometimes people are armed and we need to be careful going in there. So there may be a delay us getting into you because sometimes before we break into a house, we'll wait for the police or law enforcement to get there so that they're there to support us in that as well.
Okay, that's really interesting. I'm learning a ton of information, so thank you so much. One of our participants asked, what navigation system are you using to choose the correct route? Where he lives, the Waze and Google Maps show a route going through a locked gate to his villa at La Costa Glen. So he's wondering, what do you use? What's the best? I want to know what's the best navigation to use then.
Well, you don't have access to our navigation system. we have what's called a Cad system, which is a computer-aided dispatch system, and it uses an AVL locator, which is an automated vehicle locator. So all of the fire engines and ambulances that go in most jurisdictions now, their location is sent to the dispatch center. Their GPS location is sent to the dispatch center, and they're constantly updating that every microseconds. It updates anytime a unit moves. The computer knows where every unit is. And when a call comes in for an address, the computer picks up that address and then automatically goes through the routing to the closest units and sends the closest unit to that house. It's all done by the computer. And then on our end, in our ambulances and our fire engines, and in most jurisdictions, we have computers in the units, and they have a routing system that's hooked up to the CAD, and we just push the button and it will send us on the route that the CAD used to determine we were the closest unit. So it's not a Waze, it's not Google Maps. It's actually done through the ArcGIS system, which is the county's mapping system, because we have the ability, if we find a blocked gate or a road that doesn't exist or an error in the mapping, we can send that to the county and then have those maps get updated. That's done very regularly. And so changes can occur. Whereas in Google Maps and those kind of things, we have to kind of wait for their updates. So we can do it almost real time to get changes made.
Nice. All right. Thank you for that.
And then also to add on with John, we also have, for the most part, we have keys to all those gates. So we have ways to get in those gates without wrecking them as well. So gates aren't usually a problem.
Okay. Thank you, guys. I have another question. Something that we didn't discuss at all is what's going on with COVID right at the moment and how that's affecting affecting people when they call 911? Any changes in the procedures that you guys have? Can people ride in ambulances with each other, or what's going on? If someone could shed some light on that.
Okay, yeah, the county, it has changed a little bit. What happens when you call 911 is you will get a couple more questions asked by the dispatcher, and they are COVID-19 specific questions. They'll ask you if the person's had a fever, or if they've been sick with flu type symptoms, or if they've had a loss of taste or smell, or been in contact with anybody that's been COVID positive. And if those questions are yes, they send that to us on our computer, and we know ahead of time going in that there's a potential for this to be a COVID related type question. Obviously, if it's a vehicle accident or something like that, those questions still get asked, but they're not quite as relevant as if it's somebody that's sick at home. So they ask the questions, we get that information, and if it sounds like, if someone calls for difficulty breathing with flu symptoms for the last few days, they have a fever, then what we'll do is we take normal precautions anyway when we go in. We wear protective clothing, we wear eye goggles and N95 masks to prevent us from any kind of transmission. Mostly it's for protecting our patients, because in a lot of cases, we're in contact with a lot of sick people. We don't want to spread that around to our patients. So we try to keep from being carriers ourselves. But we will then, if it looks like it may be a COVID-19 case, we will limit the number of people that go in to just a paramedic, and he'll be gowned up a little bit more heavily with more PPE. And then if he needs more assistance, we can go in and help, or we can wait till they come out in the fresh air. And we handle the call a little bit differently. We've taken a few more precautions in that respect. And the hospitals now are not allowing, ambulances aren't allowing family members, except in certain cases, to be transported with the patient because of the COVID restrictions. And those would be, if the patient is a potential stroke patient and they're going to a stroke center, and they can't speak or communicate, then we try to take a family member with us, because they need to have that for consent at the hospital. If it's a minor, obviously we'll take a parent, to the hospital, because they have to give consent, and they're the guardians. So in situations like that, we can take, family members if the situation warrants it. But at the hospital, they're not even allowing most family members come into emergency rooms or into the hospital anyway. So what we've been suggesting or advising families to do is to make sure that their loved ones have communication and phone numbers that they can contact, so that when they get to the hospital, they can give that to the hospital, and the hospital is able to contact family members to let them know when they can get out of the hospital and when they can come and pick them up, because they're not allowed to wait in the waiting rooms anymore.
Wow.
Or in the bedsides even.
Craziness, total craziness.
Yeah, it's changed things a little bit, but it doesn't change our response when we get the call. Our goal is still to get there as quickly as possible, and to get to the patient as soon as we can and start to render aid. All the rest of the COVID stuff, that's just a few extra pieces of clothing we have to wear.
Right. Thank you for that. I have a question also. Do you have any idea, any of you guys, of the number of calls that are fall related that you get in your station? Roughly, do you find
I don't have the actual numbers. It's a lot. It's probably one of our most common calls. I did look up, the national statistics are, 1 in 4, I believe, people, not just patients, but people over the age of 65 are going to have a fall. And a very high percentage of them get hurt from that. And I think nationwide, it's every 19 minutes an elderly person dies from a fall related incident. So it's really very, very common. It's one of our most common types of calls. And the biggest thing for us is that so many of these are preventable. People fall for a number of different reasons. Like Ennis said, gravity's a law, not a suggestion. It's always going to be there. And as we get older, we just tend not to bounce as well as we did when we were little. And so we need to be, not in a hurry, and taking care and extra precautions around the house, making your house fall safe by removing slippery rugs on the floor and trip hazards that are between you and places that you tend to walk. Like for me, I'd be between me and the refrigerator, or You know, for a lot of people, it's the most common place to fall is in the bathroom, because they go from a carpeted floor to a linoleum or a tile floor, and it has that loose little rug on the floor, and they slip on that, and that's a hard floor, and they fall, and then they wind up injuring themselves, or in the shower getting in and out of a wet bathtub with a wet floor. So that's a very common place to fall. So you know, taking those extra precautions around the house to prevent the fall is the best case scenario. You don't want to have to call us, that's for sure. We don't mind coming, but it's all better if nobody gets hurt.
Agreed. Well, thank you so much. If there's any other questions, please type them in, or if you'd like to unmute yourself, feel free to unmute yourself and ask the question. We'll give it a second. Okay, well, I want to thank you all for attending this presentation. I personally have learned a ton, and I thank you guys so much for taking time out of your busy day. Please stay safe, everybody. Also know that there are many other seminars with the Fall Prevention Task Force happening this week. One of them is about home safety, so thank you, John, for leading into that. That's actually the topic I speak about on Wednesday at 9 a.m. It's all about home safety with the Home Safety Sisters, and I am one of those sisters. So I'd love for you to attend, but there are many, many other events. If maybe, Carolyn, you could put up the calendar of events, that would be great. Perfect. So there you go. As you can tell, every day we are going to be having 4 different events. One of them is going to be an active event, and it will indicate to you that it is an active class. And those are always at 12:30 in the afternoon. So many different classes dealing with technology, preventing falls and fractures. That's a movement class. There's also conversations for caregivers. There, I mean, you can see the calendar. Why does dementia increase the fall risk? How you can improve kitchen safety in the COVID-19 world. So there's lots of opportunities for you to learn more about fall prevention. So hopefully you found this seminar educational and helpful. Thank you so much for attending. If you have any questions, feel free to reach out to us. The email for questions is healthierliving.hhsa@sdcountyca.gov. Thank you so much. Have a great day, guys.
Thank you for inviting us.
Thank you. You guys were great. I found it so helpful. I learned so much from this, my God. So thank you.
Oh, good. Thanks for having us.
You're welcome. Thank you, guys. Bye.
Thank you.
All right.
Well done.
Bye, guys.
Bye.